Hello, my name is MTapia, and I will be discussing global eHealth with the focus on the World Health Assembly 2005's report submitted to the World Health Organization. The WHA 58.28 identified the need for eHealth initiatives to be assessed, provide data-driven results, plan for the interventions, implement, and evaluate actions internationally, with the emphasis on poor socioeconomic level countries. The WHA recognized that eHealth advantages include data-driven initiatives that not only facilitate access to health, but are also cost-effective measures to information and communication technologies. The WHA had an urgent request to their members, and there are 7 tenets that were of utmost importance, all of which provided a mechanism in place for assessing needs, collecting data, detailing results, implementing findings, and sharing information with the sole purpose of providing needed healthcare needs to underserved populations. One of the best examples I have of this is I spent 6 months when I was in the military in Honduras. I had never seen or experienced life in a third world country, and one of the big things back in 1995 was the uncontrolled, preventable illness of malaria, especially malaria in children. So during the rainy season, malaria would flare up because, as you know, it's a mosquito-borne illness that affects children, that affects adults. And through this initiative, this WHA 58.28, they have reduced their malaria incidence from 1995 to now, which is not an issue anymore because they got the word out. They were very active in eHealth come 2000, and the Minister of Health implemented email blasts and phone blasts, texts to their to everyone who had a phone, and most often than not they do have cell phones. And so these email blasts were, okay, it's time to put your nets up for when you sleep, when you're in your homes, in your windows. And they had funding, a grant funded, pretty much, it was extensive funding for mosquito nets for all households. So this impacted a great deal in the prevention of the illness. So again, these findings and this sharing of information was critical to reducing the incidence of malaria in Honduras. The WHO also set 8 tenets to the General Director to promote eHealth findings, encourage implementation ventures, as well as finding best suitable practices that are endemic to specific areas, as not all practices apply to all areas and cultures. Additionally, emphasis on e-learning and prevention of illness was critical in reducing mortality and morbidity. The WHO also put out an editorial related to the WHA 58.28 resolution, and they put this out in 2012, identifying current gaps in the initiative. I mean, it was all said and done. It was a great idea. However, the infrastructure was lacking, and there needed things to be done to implement, and they identified through a study, many studies, that what was needed. So the authors identified there exists opportunities to make things better, where they determined more research needs to be done related to eHealth access, outcomes, and education endeavors. Critical to all the WHA identified was the element of funding. So who is going to pay for this? Where is the funding going to come from? Studies and findings would generate grants for the underserved communities and countries, so more research and evidence-based guidelines would need to be established. The editorial also identified that in order for a successful stance on eHealth policies and practices, that research and implementation must be holistic, evidence-based, to meet the needs of all cultures, backgrounds, and geographical areas. The authors identified eHealth strategies to obtain better outcomes by better data management, improve communication efforts between patients, physicians, and communities. Key emphasis identified that it wasn't just about research, evidence-based practice, and establishing guidelines and best practices, but the sustainment of these practices and guidelines to improve the eHealth perspective, but also improve health outcomes of the community at hand, and improving access to eHealth, to the internet, to technology associated with eHealth. So my question to you is, how could the elements of mobile health, as many rural areas in poor countries rely on mobile health initiatives, ease the transition to eHealth to generate better outcomes in underserved countries with limited access to technology and internet? Thank you very much for listening, and I hope to hear from you in your answers. Thank you.